Bismillahirrahmanirrahim. Today we are going to discuss about the radius. Radius is the lateral bone of the forearm as it lies laterally in the forearm. It is here like this, and on the medial aspect there is ulna. Okay? Ulna is always medial and radius is always lateral to that. So this radius is the bone that is has an upper end, a shaft and a lower end like other bones. So first of all we should remember the point of a site of determination. Okay, the first point of site determination is that upper end is disc shape and while the lower end is expanded. Now in this bone you can see that the lower end is expanded as we said. So this one is the expanded portion and this one is the small disc shape head. Okay, so we should remember that this is the head and this is the lower end, upper end and lower end. We determine from the first point of side determination that the upper end is disc shape, which is called the head of the radius, and the lower end is expanded with a styloid process. Okay, you can see here just on the lateral aspect there is a styloid process. Okay, this is a bony projection. We all have the radial styloid process here in our body, as the ulnar styloid process is more prominent, but on the lateral aspect there is a small bony projection. You can feel this is the radial styloid process. So the first point of identification is the upper end is disc shape and the lower end is expanded. Now the second point of identification is that the lower end has an anterior surface in the form of a thick prominent ridge and the lower end's posterior surface has small grooves. Okay, you can see here these are the grooves on the lower end. Okay, and this is the anterior surface of the lower end that is in the form of a thick prominent ridge. Now the third point of side determination is that the sharpest border of the shaft is the medial border. When you feel the radius, you can feel that the sharpest border is this. So this should be lies medially. Okay, so I have put the radius in a proper direction, that this is the medial border, or it's also called as introitious border because there is introitious membrane that is present here and along with the ulna. ठीक है, इसके lateral aspect के ऊपर रेडियस है, मीडियल पे अल्ना होती है और इनके दरमियान में इंट्रोशियस मेम्ब्रेन होती है. सो दैट्स वाई दिस मीडियल बॉर्डर इज ऑल्सो टर्म्ड एज इंट्रोशियस बॉर्डर. So the sharpest border of the shaft is the medial border and the upper end is disc shape and lower end is expanded. Now these points have been confirmed. Now the fourth point of identification is the lower end presents a tubercle on the posterior surface. So now we determine that the anterior surface has in the prominent ridge and posterior surface has a tubercle. You can see here very easily that there is a tubercle on that. This prominent tubercle of the radius is termed as tubercle of Lister. Okay, dorsal tubercle of Lister that is present on the lower end of the posterior aspect or posterior surface of the lower end has tubercle that is termed as dorsal tubercle of the Lister. Okay, so it should be lies posteriorly. So this is the posterior part, this is the anterior part, this is the medial part of the shaft and this is the upper end. So this is the normal anatomical position of the radius. So this radius is of the left side. Okay, now we determine the side of the radius. Now we are going towards its features. Similarly, like bone humerus and in the lower limb you will learn about the tibia and femur. It has similarly upper end, shaft and lower end. Now first of all I am going to explain the upper end. Upper end में हमने जैसे पहले बताया था, upper end has a head that is disc shape and it is always covered with hyaline cartilage. Okay, it is always covered with hyaline cartilage because its superior concave surface articulates with the capitulum of the humerus at the elbow joint. Once you will learn about the elbow joint, you came to know that the joint is made up between the superior concave surface of the radius with the capitulum of the humerus. Now the circumference of the head is also articular. This one area, this is also articular. How it is articular? That the circumference of the head is making form by the there is a small socket just below the head is the small neck. ठीक है, this is the constricted area just below the head is called as the neck of the radius. ठीक है, this radius has a neck and this is the head. Okay, it fits into the socket formed by the radial notch of ulna. Here you can see the radial notch of ulna. I will let you know that in the ulna there is a radial notch. ठीक है, in the ulna there is a radial notch. You can see here this head will join at this point. Okay, now this the circumference of the head fits into the socket that is formed by the radial notch of ulna and annular ligament. ठीक है, इसके ऊपर एक ligament attach होता है that is called as annular ligament and they forming the superior radio ulnar joint. As we told at this head is also articular, so it's mean the superior surface is articular, head is also articular. Why it is articular? Because it fits into the socket that is formed by the radial notch of ulna. ulna के ऊपर radial notch होती है और इसके अंदर head of the radius join करता है, that is forming the superior radio ulnar joint, and annular ligament is surrounding this disc shaped head. Okay, so just below the head there is the neck of the radius. Neck is enclosed by a narrow lower margin of the annular ligament and the head and neck are free from capsular attachment and can rotate freely. ठीक है, जाहिर है इसके ऊपर कैप्सूल अटैच नहीं होगा, अगर कैप्सूल अटैच होगा तो it cannot move freely. Okay, so the capsule is not present or it is free of capsular attachment, the head and the neck. Okay, so that it can move easily or the superior radio ulnar joint will move freely. Okay, now just below the neck of the radius is this small or we can say it's a very prominent projection that is called as tuberosity. This tuberosity lies just below the medial part of the neck. You can see here that it lies medially. Okay, it just lies medial part of the neck and this is called as the radial tuberosity. Okay, this is the radial tuberosity. Okay, it has a rough posterior part and a smooth anterior part. You can feel that this is the smooth anterior part and the rough posterior part. So this is the radial tuberosity, this is the neck of the radius and this is the head of the radius. So this was whole about the upper end of the radius. Now we are going towards the shaft. So shaft has 3 borders and 3 surfaces. Okay, radial shaft has 3 borders and 3 surfaces. First of all, the borders. The anterior border extends from the anterior margin of the radial tuberosity. Okay, the anterior border extends from the anterior margin of the radial tuberosity. It just move like this. Okay, and just inferiorly close to the styloid process. Okay, it moves like this and it's forming the styloid process. ये पूरा का पूरा this one is the anterior border. Okay, the anterior border extend from the anterior margin of the radial tuberosity. ये radial tuberosity का anterior margin है, उससे जो extend कर रहा है that is the very easy है इसके में border, क्योंकि बिल्कुल anterior border of the radial tuberosity से move करेगा and down close to the styloid process, नीचे styloid process तक जाएगा. ठीक है, यहाँ तक. It is oblique in the upper half. You can see it moves like this. This is oblique in the upper half and vertical in the lower part. Okay, simple. In the lowest part is very sharp or it's its crest line. Okay, so the oblique part is called as anterior oblique line. Okay, this one, and the lower vertical part is crust like. So you can see in this that this was the anterior part. Now come on towards the posterior border. Posterior border, this is just the mirror image of the anterior border. ठीक है, बट इट इज़ वेरी क्लियरली डिफाइंड. ये बिल्कुल उसके पीछे, एग्जैक्टली पीछे दिस इज़ द पोस्टीरियर बॉर्डर और ये बिल्कुल स्ट्रेट होता है, बहुत प्रोमिनेंट होता है, कोई भी मुश्किल नहीं होती इसको ढूंढने में. इट इज़ क्लोजली, इट इज़ वेरी क्लियरली डिफाइंड. इट्स मिडल 1/3 पे तो बिल्कुल ही प्रोमिनेंट रिज की तरह होता है. ठीक है, दिस इज़ द पोस्टीरियर बॉर्डर. पोस्टीरियर बॉर्डर इज़ द मिरर इमेज ऑफ एंटीरियर बॉर्डर. ठीक है, द अपर ऑब्लिक पार्ट इज़ नोन एज पोस्टीरियर ऑब्लिक लाइन. पोस्टीरियर थोड़ा सा ऑब्लिक होता है, फिर नीचे जाके बिल्कुल क्रस्ट लाइक हो जाता है. तो ये दिस इज़ द पोस्टीरियर ऑब्लिक लाइन एंड दिस इज़ द एंटीरियर ऑब्लिक लाइन. ओके, now come on towards the third border, which is the medial border. I have told you previously that the medial border is also termed as interosseous border. It is the sharpest of the 3 border and extend from the radial tuberosity. बिल्कुल radial tuberosity से शुरू होगा. ठीक है, ना इसके anterior ना इसके posterior, बिल्कुल इसके middle से. The medial border extends from the radial tuberosity above to the posterior margin of the ulnar notch below. Okay, be remember this thing. This is the ulnar notch. Why it is called as ulnar notch? Because the ulna will, ये जो अल्ना का हेड होता है ये आपको बाद में पता चलेगा कि ये नीचे होता है, ठीक है. द लोअर एंड ऑफ द अल्ना इज टर्म्ड एज अल्नर हेड. सो द अल्नर हेड ज्वाइन ऑन दिस क्या कहते हैं उसे, अल्नर नॉच ऑफ द रेडियस, ठीक है. अल्नर नॉच ऑफ द रेडियस पर ये ज्वाइन करता है एंड इट विल फॉर्मिंग द लोअर रेडियो अल्नर ज्वाइंट. ओके, सो दिस इज द अल्नर नॉच, ठीक है. ओके, दैट दिस मीडियल बॉर्डर के बारे में हम बात कर रहे थे, दैट द मीडियल बॉर्डर एक्सटेंड फ्रॉम द रेडियल ट्यूबरोसिटी, ठीक है, रेडियल ट्यूबरोसिटी अबव टू द पोस्टीरियर मार्जिन ऑफ द, ये जो कि ये पोस्टीरियर मार्जिन जो आपका है ना, ये अल्नर नॉच है, ठीक है. अल्नर नॉच का ये पोस्टीरियर मार्जिन है, ठीक है. यहाँ तक जितना भी आ रहा है ये पोस्टीरियर मीडियल बॉर्डर आ रहा है, ठीक है. ये मीडियल बॉर्डर फुल जो है ना उसको कवर करता है. नाउ कम ऑन टूवर्ड्स द इंट्रोशियस मेम्ब्रेन. इंट्रोशियस मेम्ब्रेन इज अटैच टू द लोअर 3/4, ठीक है. ये इसका जो है लोअर 3/4 के ऊपर इंट्रोशियस मेम्ब्रेन अटैच होती है, ठीक है. In its lower part, it forms the posterior margin of the elongated triangular area. Okay, ये triangular area होता है, ठीक है. ये यहाँ तक इसके आ रहा होता है posterior margin. Okay, so this was the medial border, this was the anterior border, and just mirror image of that is the posterior border. ये बिल्कुल आपको prominent नज़र आता है, ठीक है. But you have to hold the radius in a normal anatomical position. Now the surfaces. You can easily say that the anterior surface lies between the anterior and the introitious border. Anterior and the introitious border is all of this is the anterior surface. Okay, a nutrient foramen opens in its upper part and it is always directed upward. अब इसमें आपको वीडियो में तो इतना prominent नज़र नहीं आएगा, लेकिन ये यहाँ पर इसके बहुत न्यूट्रिएंट फोरामेन है. हर बोन में तो नज़र नहीं इतना prominent आ रहा होता, लेकिन जो मेरे पास बोन है इसमें पता चल रहा है न्यूट्रिएंट फोरामेन. ओके, द न्यूट्रिएंट आर्टरी इज बेसिकली द ब्रांच ऑफ एंटीरियर इंट्रोशियस आर्टरी. ये आपको यहाँ पर याद रखना है कि न्यूट्रिएंट आर्टरी किसकी ब्रांच होती है, तो इट इज़ अ ब्रांच ऑफ एंटीरियर इंट्रोशियस आर्टरी. नाउ द पोस्टीरियर सर्फेस. पोस्टीरियर सर्फेस लाइज बिटवीन द पोस्टीरियर and the introitious border. This is the posterior surface. Okay, this is whole the posterior surface. Posterior surface lies between the introitious border and the posterior border. This is the posterior surface, this is the anterior surface. Now one surface that is lies laterally is termed as lateral surface, which lies between the anterior and the posterior border. Okay, very easy. Anterior surface lies between the anterior and the introitious border. Posterior surface lies between the introitious border and the posterior surface, and lateral surface lies between the anterior and the posterior surface. Anterior posterior के दरम्यान में जितनी है ये सारी, that is the lateral surface, ठीक है. Now a very important part of the radius is the lower end. In most of the examinations usually the lower end is asked. Why? Because there are multiple grooves for extensor tendons. Now this is the lower end of the radius, and it is the widest part of the bone. It has 5 surfaces. Be remember this thing, it has 5 surfaces. How? Anterior surface in the form of a thick prominent ridge, जो कि मैंने आपको पहले भी बताया था. और इसकी क्या इंपॉर्टेंस होती है? The radial artery is palpated against this surface. Okay, the radial artery palpated against this surface. This is the anterior surface of the radius. Then posterior surface, ये सारी की सारी posterior surface है. Posterior surface presents 4 grooves for the extensor tendon and the dorsal tubercle of Lister's, which I have explained you पहले previously. Lies lateral to the oblique groove, ठीक है. बिल्कुल ये anterior surface हो गई, और ये बिल्कुल इसके पीछे posterior surface हो गई. Posterior surface में 4 grooves होते हैं, जो कि आपको फिर attachment से बताया जाएगा कि यहाँ से कौन कौन से tendons गुजरते हैं. Then अब मैं normal anatomical position पकड़ रही हूँ. This is the medial surface. Medial surface is occupied by the ulnar notch for the head of ulna. I have told you previously कि किस तरह से head इसके साथ मिलता है ulna का, और it forming the inferior radioulnar joint. Then the lateral surface. Lateral surface भी मैंने पहले बताई थी. It is prolongated downwards to form the stylet process. That is the stylet process of radius. Now the one thing that left behind is the inferior surface. ये देखिए inferior surface क्या है. Inferior surface आपको properly पता चल रही है कि there is a triangular area and a medial quadrangular area. ये देखिए medial quadrangular area नज़र आ रहा है, और ये triangular area नज़र आ रहा है. The triangular area is for the scaphoid bone and the quadrangular area is for the lunate bone. Once you will learn about the carpal bones, then you came to know that how they are arranged. But for the time being, you should remember that on the radial inferior lower part on the inferior surface, there are two areas, one for the scaphoid bone and one for the lunar bone. For lunar bone, there is a quadrangular area, and for the triangular area is for the scaphoid bone. Okay. This surface mainly takes part in the form in the wrist joint. Okay. So radius is a very important bone. It is forming in the on the inferior surface with the carpal bones forming the wrist joint. On the medial aspect, it making a joint with the inferior ulnar radial ulnar joint and superior radial ulnar joint. So it is very important bone. You have to memorize this. Thank you so much.